Hey guys, how you doing out there? Thanks very much for tuning in to my 11-month after surgery update. And wow, I mean these months are screaming by, incredible really. And I'll get to the results in a second, but just wanted to talk you through a couple of things of where it is really. I think the one thing about this journey is I've certainly lived life in the last 11 months and continued as was, but you do find that if you have work done, that you could find yourself almost wishing weeks, months away, wanting to get to that kind of year marker. So it kind of sounds silly, and I don't mean it the way it's going to sound, but it has almost taken a year of my life, and I don't mean that I've done nothing in between that. Of course, like I say, I've lived every day as it was, but you find yourself checking, wanting results. So, you know, be prepared to kind of sidetrack your regular thinking process into one that might last a year to you to get to these results. So I'm going to give you guys a close-up because I've been asked to shoot a really close, tight shot of the hair. I'll try my best to get it done. I mean, you know, single-handedly up there, it's not always that easy. So I will certainly do that for one of the guys out there that's asked for that to happen. And you know, the following's coming on really nice. It's nice to know that there are that many people wanting to follow this journey, clearly wanting some information about possibly taking the next step. Or there's also some guys out there that, you know, you've already had the work done, and I guess you're comparing to see how it's going. And I hope your journey's going as well as mine, and that your end results turn out as well as mine have. So yeah, listen, that's really great to know that there's so many people viewing these videos and pinging me the odd question, and if I can answer, then I'm more than happy to try and do that. You know, no expert in this field other than the fact that, you know, I'm 11 months into a journey that I know that I've experienced every second and every day of it, and tried to document it for you guys as best as possible. So yeah, I'll stop waffling now and give you guys a close-up. And what I'll do while I'm here, actually, I'll give you guys a little bit of a 360. I'll get a little closer, just so you can kind of see how it's going at the back there. One of the things actually I've never had any issue with it was the back. I talked my barber into going shorter and shorter, and I'm having trouble to get him to go short enough. I had this done a week ago, and I would like it a lot shorter, but anyway, listen, that's an ongoing battle with me and the barber, but we'll get there. But that scar has never been exposed, and I'll do it. I'll give you guys a shot actually of the, or at least try and expose the scar, just so you can kind of get in there and have a look. Yeah, I don't know if you're going to see. I know when I played these videos back, you struggle to pick that up. You may just get a faint line, but definitely a lot shorter to go if needed. So yeah, let's shoot this close-up video for you guys. This may go out of focus, so just bear with me, hang in there. Here we go. I'll give it a little part in there. Again, I don't know how unfocused this is going to be, how much you guys need to see. I can just about see that shot there actually. So yeah, there we go. I'll give you a bit at the top, I think. I mean, it's certainly, you know, thinner up the top here, but you know, the 4,000 grafts were always, they had to be kind of tactically placed to fill in how much I'd lost. So yeah, I hope that's close enough for you guys. I mean, this month and certainly the month before, it's really thickened up. I've changed my hairstyle slightly. It's kind of normally a little bit more set in place than this, with a bit more wax on it. Again, a bit shorter, and it's just coming off to the side a little bit, and I do like that actually. I kind of change from the fact that it's either brush forward and messy or to the side. Forgive me because it's obviously not in the mirror, so it's going to be a bit bashed up, but yeah, there it is. I mean, the back, I would say, is a little bit unsettled. I don't think it settles down as nice as it could, but it certainly doesn't cause me any issue once I put a little bit of product or something in it. So yeah, that's that. But yeah, the last couple of months it's thickened up. It's thickened up really nicely. And I think I've probably had all the growth that I'm going to get out of it. Now, if any more turns up, bonus, but that's probably it. So it's all about thickening up and settling in now. The one thing I did want to do actually, I've arranged with the Maitland Clinic to go down in a couple of weeks' time. They're going to kind of shoot, because I mean, believe it or not, a year is incredible. A year in, and they're going to do like a before and after photo, possibly a video. I can't say I've checked their website to see what they've done, but anyway, they're going to do that. And what I'll do is, I remember going down to the appointment, and I have documented it at the start of this journey. And I don't know if I mentioned that I was nervous about the idea and going in, because it's the unknown. So what I'm going to do is I'm going to contact David, the Maitland Clinic, David Anderson, and ask him if it's possible if we can shoot a video walking in, because it was a little bit of a hang up of mine. And my guess is it would be a hang up for you guys as well, because the Maitland Clinic is inside a huge complex, and they're just one of many companies that are operating out of this really lovely modern complex. So walking in, you kind of have to announce yourself to the main desk there, and then they point you in the direction of the Maitland Clinic. So it's a little daunting, I suppose, if you're a little bit worried about it, and some guys are a bit, use the word secretive, but precious about the information they want to give out about what they're having done, and that's fair enough. I've decided to document my journey. Some guys want to choose to not tell anyone. So yeah, I'll ask David and see if we can shoot a video on the way in, so you guys can get a feel for what it's like to announce yourself down at the Maitland Clinic. So yeah, that'll probably do me for now. How long have I been running? 7 minutes. That's as long as I need to chat to you guys. I will probably post actually a little bit shorter than a month's time, because I want to do one on the anniversary, actually 1 year in exactly. Won't have much of an update, won't be very different, but yeah, there we are. See, there's a bit sticking up, there we go. But I'll just mess my hair around. Listen, thanks very much for tuning in, guys. I really appreciate all the views and hope that this information is helping you. And I'm going to tune out and catch you guys later. Cheers, bye bye now.